Welcome to Dignity Health Social TV. Today we're talking to ophthalmologist Dr. Haugen. You are, I want to get this right because I always mess this up, you are an ophthalmologist, not an optometrist, is that right?
You got it right, Nathan.
Yes.
Nice.
So what's the difference?
So an ophthalmologist is a subspecialty just like a cardiologist, just like a trauma surgeon, where we go to medical school and then we do a residency in ophthalmology, where we then can diagnose diseases of the eyes or treat different surgical diseases of the eye. Optometry is where you go to optometry school and then you go and take care of patients after that, with learning about all the diseases, but not necessarily the surgical aspect of things.
So there are a lot of things that you see in your field. A lot of surgeries and different things that you encounter?
We see a lot of things, and that's one thing that a lot of people don't realize is you can discover a lot about your overall health with just an eye exam. And so people with diabetes, it's important to come in and see us. People with high blood pressure. And we can even detect strokes before they happen based on eye exams.
So just through a simple eye exam, I can find out from you whether or not I have diabetes?
Yes.
And so you do surgeries as well, correct?
We do surgeries. Okay. We do cataract surgeries. That's one of the most common ones we do. Everyone's got a cataract. It's just a matter of when they get it. Cataract surgery used to be a pretty arduous type of surgery and have a huge recovery time. Now the surgery itself takes only about 5 or 10 minutes, and you're usually seeing better within a couple days afterwards.
And what does that surgery involve? Are you're putting in something? Do you have
I do.
An example? Oh. Yeah. Okay. What is this?
So this is the implant. So when you have a cataract, you basically have a clouding of the lens inside your eye. We have to remove that cloudy lens and replace it with something else. At that time, we then can change your prescription. We can also correct your astigmatism. These are some new technologies that have come out in the past years to allow you to see better at distance, to reduce astigmatism, and even technology that help you see better near and far, much like you did when you were in your 20s and 30s.
Okay. Is that going to fit in my head?
This is not actual size.
Okay. I was going to say, it's pretty big. It's just a small fraction of that size, right?
The incision that we make is 2.4 millimeters.
Okay.
And the lens itself is unfolded 6 millimeters across.
Okay. As a patient or a prospective patient, what would be some symptoms or some signs that I would experience that would kind of alert me to say, I need to go see you?
Great question. We have a lot of people come in, they want to see better and they want their eyes to feel better, especially in the North State. Environmental conditions here, usually with high heat, low humidity, and all the different orchards that we have around here can cause a lot of irritation to the surface of your eyes. We call that dry eye disease.
Okay.
There's a multitude of treatments for dry eye disease, anywhere from over-the-counter drops to amniotic membranes. To find out which treatment is right for you, we tailor that treatment to you when you come in for your eye exam. Okay. And we can figure out what exactly you need for that dry eye therapy.
Now there is also some misunderstanding about insurances, is that correct? Do I need vision insurance to see you?
No, you don't.
Okay.
And so that's a great question that a lot of people ask when they call into our office. As I mentioned earlier, we can catch things like diabetes, we can catch things like high blood pressure on that. So your overall health can be determined or can be seen through your eyeballs, so medical insurance will cover it. Medicare, if you're over the age of 65, pretty much always covers an eye exam for the medical purposes. Okay. If you're under the age of 65, there's a multitude of different types of medical insurance. Best to just call your doctor's office, find out if they accept it. If not, what would be required.
Awesome. Hey, thank you so much for hanging out.
Hey, my pleasure. Thank you for having me.
Yeah. Thank you for watching Dignity Health Social TV. For more information, you can visit mercy.org.